The reason that I became a primary care physician is when I was in medicine and going through medical school and residency and doing all my rotations, I found an interest in a lot of the different fields and the different subspecialties. And when I was doing primary care rotations, family medicine and internal medicine, I found that that's what fit the best for me, that I was the most interested in treating the whole patient and not just focusing on one system. I found that I wanted to be able to address all of the patient's concerns and maybe not just one system or one complaint, just treating their lungs or just treating their heart. I liked that I was going to be able to have control and have that relationship with them over the whole body. When new patients schedule an appointment with our office, they should expect to be here a little bit longer than a normal visit. They do have to fill out a patient history form so that we can get their full history. And then once they see me or get in the room with me, it'll be a little bit more lengthy of a history taking, making sure we're on the right page as far as their medications and their past surgical history, their current complaints and the reasons that they're there to see me on that day, and then usually a full exam on the first visit with me unless there's one directed complaint. My medical philosophy, which is one of the whole DO philosophies or the osteopathic medicine philosophies, are that we treat the patient as a whole. So it's not just their medications and just their history or their medical diagnoses, but it's the whole patient and, not just their medical concerns, but sometimes just listening to them and what they need personally and not just physically with their history or with their medical diagnoses. I chose to become affiliated with Mount Clemens Regional Medical Center because when I was a medical student, I spent 2 years of that time, 2 years out of the 4 years at Mount Clemens, and I know the hospital very well. I know the specialists, I know the nursing, I know the care that my patients are going to get, and I know if my family member was sick that I would feel comfortable with them going there. So when I graduated from residency and was looking for a job, Mount Clemens was on the top list of the places I would feel most comfortable working at because I see my patients as my family members, and if I trust my family to be there, then I definitely feel comfortable with my patients receiving care from the hospital and the specialists associated with that hospital. I think the best steps a patient can take to maximize the relationship with their physician is really communication. I think that's probably one of our biggest problems on the patient end and on the physician end, where we don't always communicate honestly and openly. So, not feeling rushed and giving the patient time to fully voice everything that they're there for that day and all of their concerns that day. And hopefully I'll be there to listen to them, understand what they're going through, and be able to give them answers. And I think a lot of times patients just want the answers there. I do spend a lot of time calling patients back personally. I do send some letters through the mail, but a lot of the time I'm doing a lot of phone calls throughout the day and speaking with the patients, having them come back sooner so we can have a discussion even in the office so that we can understand what the treatment goals and options are for the patient. I think the most important step towards maintaining a healthy lifestyle is just being an overall healthy person. I don't think diets work, and I don't think as a physician I can tell you this is what you need to do. Just having an overall healthy lifestyle, eating correctly, exercising regularly as much as you can, and then having physical well-being and mental well-being. So having a good family life, friends, good social life, all those things combined kind of make a healthy person, not one or the other. Medical diagnoses or problems will come and go. And we can treat those, but you can't really treat the person. They really have to be able to do things on their own too. So hopefully as a physician, one of the other things that I do is a lot of patient education on being healthy overall. I don't prescribe diets and I don't prescribe diet pills. It's really just being a healthy person, having the healthy diet and exercising regularly and, having a good social life. All those things together I think make a healthy person.